Hello friends, we will be discussing cardiac electrophysiology today. The heart, it is composed of 4 chambers, as you can see, 2 atria and 2 ventricles. And then what I will be concentrating on is the conducting system of the heart, which is composed of one, which I have made in red. One thing is this SA node. SA node is present in the right atrium, just at the opening of the superior vena cava. Then there are some internodal fibers, and then second thickening is the AV node. Okay. Then after the AV node we have this bundle of hairs, then the bundle branches, and finally the Purkinje fibers. Now this is the conducting system, as it helps to generate and conduct a cardiac impulse throughout the heart. Okay. Now the cardiac myocytes or the cardiac cells, they can be divided into 2 types. These conducting fibers are one, and the other one are the contracting fibers. So the contracting fibers I will not be discussing much, but the conducting fiber is my point of interest today. So now if you look at the action potential, I have already discussed the nerve action potential, and you know that the nerve action potential is a simple spike. It goes up and it comes down, that's it. But in case of a cardiac muscle, there is a little difference, and generally the difference is that the action potential curve, it looks something like this. Okay, I'll be explaining all the steps of this, but this is how it looks like. Means it is wide, it is not narrow like a nerve action potential. Now the basic differences between a nerve action potential and a cardiac action potential is that, what happens in a action potential, there is exchange of ions across the membrane. So in case of nerve action potential, there are only 2 ions which were responsible. One was a sodium ion, and the other one was the potassium ion. But in case of this cardiac cells, there is one more ion which is responsible, and that ion is calcium. Okay. Now this calcium, how it contributes to this, I will be discussing when I discuss this action potential graph. Now you can see this voltage will be the resting membrane potential. Simple, just like in any other cell, this would be around -80 to -90 millivolts. And then when it reaches a point what we call as threshold, there is a rapid upstroke, just like in a nerve. And the contributory factor is also influx of sodium ions into the cell. Okay, because there are some voltage sensitive sodium channels which sense this change in voltage at the level of threshold, and many of them, they open up. When they open up, the Nernst equation for sodium is plus 65 millivolts. So there will be a rapid entry of sodium into the cell, which leads to a rapid change in the potential. So the potential goes upwards towards the positive side, means it gets depolarized. Now the sodium channels, they are called as fast channels. They open very fast, and then they go into a phase of inactivation very fast. So at this point of time, most of the sodium channels, they go into inactivation. When they are inactivated, what happens? The further upgoing of this curve stops. Okay, so this, from here to here, this point is contributed by the sodium channel opening, and it is called as phase 0 depolarization. Okay, now when it reaches the maximum point, when all the sodium channels are closed or inactivated, what happens? The next thing is, there is a rapid downfall of this potential. This is called as phase 1 repolarization. Okay, it is a minor change. And now since it is going back, what should be responsible? The ion that should be responsible is potassium. So there is one type of current of potassium which is responsible for this, and that is called as a transient outward. Okay, I will write it as ITO. That means transient outward current. This current is responsible for bringing it back somewhat. Okay, so we are done with phase 1. Then we come to phase 2. Now this phase 2 is contributed by two ions. One is calcium. Now calcium, what it does? Calcium is again an extracellular cation. So whenever the calcium channels are open, there will be entry of calcium inside. Okay, and when calcium enters, it will also bring positivity. So it will try to lift this potential. But what will happen? At the same time, there are one type of currents of potassium channels that are open, and they are called as the delayed rectifier, and these two, they just balance each other. So same number of charge brought in by calcium is reversed by same amount of potassium ions going out. Okay, so it is just cancelling each other out. So that contributes to what we call as plateau, and this is called as phase 2. Okay, then after phase 2, at the end of phase 2, or plateau phase you can call it, what happens? There is the calcium currents, they also stop. Okay, now the only current which is responsible, which is present, is the potassium current, and that leads to repolarization of this membrane back to a state of resting near the resting membrane potential. It might also go beyond that into a phase of hyperpolarization. Okay, so this phase 3, it is contributed entirely by potassium efflux. Okay, so this was sodium influx. Phase 1 was potassium efflux. So I can make it like this, potassium moving out. Then phase 2 contributed by calcium moving in and potassium moving out. And phase 3 contributed entirely by potassium moving out of the cell. Okay. Now, there is one very important role played by this calcium. When this calcium enters into the cell, it also contributes to contraction of the myocyte. But it is not only this calcium which is responsible, there is also some intracellular store of calcium, and that store is in the sarcoplasmic reticulum. Okay, now when this calcium, it enters into the cell, what it does is, it stimulates a calcium mediated calcium release from the sarcoplasmic reticulum. So the sarcoplasmic reticulum, it feeds even more calcium ions into the cytoplasm of the cell. So this calcium now helps in contraction of the muscle. Okay. So this calcium, with the help of those calcium mediated calcium release you can call it, and that happens by means of a receptor, what we call as ryanodine receptor for ryanodine, which is present on the sarcoplasmic reticulum. So some calcium coming from the outside, some contributed from within the cell, and that leads to a forceful contraction of the myocyte. Okay, now after all this is done, what is happening? What is happening to the cell? You know, there is a lot of calcium inside, a lot of sodium inside, and potassium has gone out. So now what the cell does is, it makes up for whatever has changed. So it maintains what we call as homeostasis. And for that, there are two channels which I will be discussing. One is, I have already discussed it, sodium potassium ATPase. Okay, and then there is another one which is called as sodium calcium exchanger. Okay, now what sodium potassium ATPase will do? It will simply push sodium out and bring potassium in. Electrogenic. So that is one thing. This NCX is very important with regards to the cardiac cell. This is sodium calcium exchanger. So important thing about this channel is it is a bidirectional pump. So it can work in both the directions. Okay. But now when in a cell a lot of calcium has built up, what will happen? That calcium has to be extruded out. So it will be pushing that calcium out of the cell. Okay. And this pump is also electrogenic. Okay. This pump is also electrogenic. So what happens? There will be 3 sodium entering and 1 calcium going out, which means there will be again a net with charge, a net positive charge coming inside the cell. Okay, with every this movement, with every extrusion of calcium outside the cell, there will be a movement of sodium, a positive charge inside the cell, which will lead to what? Which will lead to increase in this resting membrane potential upwards. Okay, when this happens, what will happen? It might just go and touch the threshold potential. When it touches the threshold potential, another action potential is generated. Okay, now when that thing happens, what will happen? There will be, this process will go on repeating itself. This is what contributes to what we call as automaticity in cardiac cells. Fine. And since I am discussing now automaticity, there is one more thing that contributes, and that is called as HCN channels. HCN channels, they are called hyperpolarization activated and cyclic nucleotide gated channels, which are open to both potassium and sodium. So these channels also help in elevating the resting membrane potential up to the level of threshold. So the cell can fire again and again. And this rate of firing depends on the steepness of this slope. So how steep this slope will be? This phase is called as phase 4. Okay, this phase 4, you can call it as delayed depolarization or diastolic depolarization. That depolarization, the rate of that depolarization or the steepness of that slope will determine which cell is going to fire next. Okay, so since this rate is fastest in the SA node, that's why SA node serves as our pacemaker of the heart.